With regard to our patient advocacy updates, we're going to go first to our peer support program. You're going to hear from Sarah Miretti Cassidy from the Cancer Hope Network. I'm going to ask Sarah to introduce herself and just remind everyone what means the Cancer Hope Network and how it's relevant to today's program. Sarah?
Absolutely. Well, thank you so much. I really appreciate the introduction. And on behalf of Cancer Hope Network, thanks for the time to be here. You know, as I was listening, as Congressman Carter said, if you're in this room, wherever that room is across the nation, you've been touched by cancer, whether it's giving or receiving a diagnosis, helping a loved one who's going through treatment, you know, or sitting with elected officials like Senator Van Hollen and Congressman Carter and working to legislate help. At Cancer Hope Network, our goal has always been simple: to connect cancer patients and survivors and their loved ones with somebody who understands what they're going through. And Mark, if you can bump to the next slide, please. Thanks. You know, when we started 40 years ago, there was precious little information. You know, we were the first in the nation to provide one-on-one peer support. And when we were founded by Diane Paul, who was then an oncology nurse in New Jersey, she gathered community and medical professionals to found Cancer Hope 40 years ago. And there was precious little information that was available. Oftentimes connecting with somebody who'd been through a similar experience meant it was on an ad hoc basis and you were talking to somebody who your doctor happened to know. Today, as we all know, information really abounds. And Cancer Hope Network is here to step into that information. We train survivors and caregivers as what we call support volunteers. And then we support those volunteers with a professional team who provide follow-up, additional resources, and ongoing training. And that's really important because finding the right fit on paper, my diagnosis matches your diagnosis, is important. But finding that match in person and in real life is really important too. You know, I've been with Cancer Hope Network for about 6 years, and a couple of years into my time at CHN, my mother-in-law was diagnosed with ovarian cancer. And I had literally been traveling the country telling people what a great service we are and why it was so important to connect with someone. And as is so often the case, when it happens to you, it becomes incredibly more meaningful. I was lucky I got connected up with a survivor or with a caregiver volunteer. And, you know, she helped me work through the emotional things that I was going through, but she also provided me with really practical advice. I will never forget that she shared me a way that I could move my mother-in-law without causing more pain. And that was something simple, and I could have gone online, but it was both simple and incredibly meaningful and a kindness that I will never forget. But I am not alone. More than 40,000 patients and caregivers have received that kind of connection and support in the years of our service. Can we go to the next slide, please? At Cancer Hope Network, we offer support for adult patients, survivors, and their loved ones through any phase of the cancer experience, from diagnosis through treatment and into survivorship. And as you probably each know, sitting in front of your computers, when facing cancer, patients and caregivers will often have a moment where the crisis is particularly acute. For some, it's right after diagnosis. Others, as we have all experienced, will power through their treatment and rush back to sort of life as normal, only to find out that they're living in a new normal. For others, that crisis comes when they're facing post-treatment tests and scans, or when a recurrence upends their life for a second time. Whenever that moment or moments hit, Cancer Hope Network is here. Most of our matches are based on a diagnosis or treatment match, but other factors are in play too. You know, we matched a client who kept her life complete with a high-stress job in an alpaca farm as her side hustle going, but she wanted to connect with someone who understood the balancing act that she was going through. Recently, we've matched someone who, because of the pandemic, can't find someone who's providing a prosthetic who can help her get fitted for her prosthetic. And so we've connected her with somebody else who understands what she's going through, or another who is waiting in her car, like so many others, and then walking into her treatment alone. Whatever that moment of crisis is, our volunteers are here. Oftentimes, patients will come to us soon after their diagnosis. They'll want to find help balancing the benefits and downsides of treatment options that they're presented with, or they want to learn to live with a metastatic diagnosis, and Cancer Hope Network volunteers are here. When patients are considering a clinical trial, We're here with connection and with guidance. Our goal at Cancer Hope Network, you can read the list, but our goal is to make sure that folks feel that they're not alone, to match them with a person or a people who understand exactly what it's like to be in the situation that they're facing right then. During the global pandemic, we know that support has become more necessary at all points of the lifespan, from newly diagnosed patients who are debating treatments to long-term survivors who are now struggling to deal with the additional restrictions that are necessary because of their immunocompromised systems. In fact, we've seen more than a 20% jump in the number of clients who are being matched this year. But we've also seen a jump in the next group that I'll talk about, which are our survivor and caregiver volunteers. Next slide, please. The heart of our mission and the support that we provide is offered by our survivor and caregiver support volunteers. As the Director of External Affairs for Cancer Hope Network, it is my joy to share their stories. There's Jeff, who discovered that breast cancer isn't just for women, and who's now made pink his second favorite color as he continues his work as a ham radio operator. There's Marcy, who, like many cancer patients, learned that she needed to accept help when others were offering. And Emily, who learned the same lesson. She used to say that idle hands were the devil's work, and now she's realized that sometimes idle hands are necessary. There's Jen, who is a survivor who's on long-term chemo, who's now living her best life with her dog, or Hank, who's a physician, who's learning about life on the other side of the sheet. At any given time, with these folks that I've just mentioned or others, we have between 400 and 500 trained volunteers who are actively serving. They have a variety of interests and experience. We have a private detective. We have many volunteers who are focused on nutrition and wellness. And while many matches start based on that shared diagnosis or treatment, our programs team is also here to work to connect people based on their shared experience. We will connect patients who are working through treatment, caregivers who are preparing for or dealing with the loss of a loved one. We've also connected teachers who both lost a limb to their diagnosis and to their treatment, but who had to figure out what they were going to tell their kids and how they were going to tell their students. Sometimes it's a personality fit as well. Part of our service includes follow-up, both with the volunteers who have made who have made the calls, and then checking in with the clients to make sure that they've got all the resources they need. And one of my favorite responses to a post-match survey was pretty succinct but powerful. And she said, "My volunteer wasn't warm and fuzzy, and neither am I." So there's strength in both that diversity and that knowledge. Next slide, please. And that diversity and that breadth of experience means we're ready to help. The pandemic has transformed cancer care and dramatically impacted those facing a cancer diagnosis. The need for psychosocial support is rising, and at Cancer Hope, we're committed to providing that support to cancer patients and their loved ones at any point in their journey. Our programs team is here to help with referrals. And when you use this link or call them directly and get consent, they're able to then follow. Providers and professionals are able to follow up and get updates on how those matches are going and what support their clients are feeling. For survivors and caregivers, training as a support volunteer is an opportunity to find meaning and purpose in their life after their diagnosis. Our volunteers range from, I think at last time I checked, it was 24 to 94 years old. And they can be as involved or as low key as they like to be. In several of our trainings this year, people have mentioned that it's been really meaningful to find a way to safely volunteer when their in-person volunteer opportunities were canceled. And I wanted to read real quickly, a quote from one of the volunteers who, like many others, came to us and was matched as a client and then became a volunteer. And he said, "Let me tell you about this man. When I was diagnosed in November in 2019, Cancer Hope found a cancer survivor that matched my illness for support. We never met, but formed a bond through text, emails, and phone calls. Pat always gave me hope and strength and a feeling that I was not alone. He had a lot of faith that was as strong as I've ever seen. He fought his demons like alcoholism, attending AA even through his cancer. He tried to become a better person. He loved his wife of 30 years. And though our political views were very different, we respected and cared about each other. In memory of my friend, I would like to let his legacy live on. I would like to become a member supporting others. And the final way that we can work together is by teaming up and partnering. At Cancer Hope, we believe that many hands make light work, and that collaborating with other organizations in this space can really be meaningful and help us to stretch both our financial and our time resources. So whatever the spot on the spectrum, wherever in the cancer lifespan that moment of crisis hits, we're here to help. Thank you so much.
Thank you very much, Sarah. And I've got to say that your very final sentence captured what I was putting down in my notes about your remarks. And that is an appreciation for and helping to reveal to us the broad span of whom you serve across their individual cancer journeys. We so often focus on what's the latest molecular target and kind of getting the right sort of molecular attack and different sort of approach at that level for various kinds of cancers. And you're making very clear to us it's much broader than that. And in order to support cancer patients, survivors, and their families, you have to provide such a broad array of services and just across the journey. So that, to me, was the most impressive thing that you displayed very well, and you captured it beautifully in your final sentence. Thank you.
Thanks so much.